Hi, I'm Haley Witherell from Colorado Badge Network, Agri-Science Labs, and the DAP Project. Millions of people across the states will be gathering this week to celebrate one common theme. It's 420, and it's the best time to learn how to celebrate in a safe but enjoyable way. I'm joined tonight by best-selling author of Cannabis for Chronic Pain, Dr. Rav Ivker, and co-creator of Medamints, Gabrel. Before we begin, I would prefer to hear a little bit about each of you. Dr. Rav, would you mind telling me a little bit about your background?
Oh, sure. I've been a family physician since practicing holistic medicine since 1972. And for the past 7 years, in my fully alive medicine practice in Boulder, Colorado, I've worked with more than 7,500 chronic pain patients using medical marijuana to relieve their suffering. Whatever their chronic pain condition has been, the results have been remarkable for both pain relief and a significant reduction or even total elimination of their prescription opioids, anti-inflammatories, the benzodiazepines, muscle relaxants, and sleep meds.
Thank you. Gary, would you like to tell me a little bit about yourself?
Sure, Haley. I'm a lifelong entrepreneur and cannabis activist. Before Medamints, I was creator of the popular board game called Pinte, and I created a chain of restaurants in Oklahoma known as Hideaway Pizza. Cannabis has been a major part of my life since I began using it in college, including quickly getting busted. I've used it on and off ever since to stimulate creativity, de-stress, and just generally to improve my enjoyment of life.
Thank you. Dr. Rav, I know from reading your book, Cannabis from Chronic Pain, that you had some very personal experiences with cannabis as medicine. Would you mind sharing that?
Sure. In spite of seeing thousands of these success stories with patients treating chronic pain, it wasn't until I developed a severe case of shingles in late March of 2015 that I became a fervent believer in the healing power of cannabis medicine. The pain was like nothing I'd ever experienced. I mean, I've had broken bones and acute appendicitis, an appendectomy. On a scale of 1 to 10, this was off the charts. It was consistently between an 8 to a 10 plus for the first 2 months, unless I used medical marijuana. And if I vaporized it, within just a few minutes, it was dramatically reduced to a 2 to a 4. It was like a miracle. Pain above a 5 is all-consuming and makes it extremely difficult to focus on anything other than the pain. It's incapacitating. But the medical marijuana not only quickly relieved the pain, but I was able to function quite well, to lead a relatively normal life and even enjoy my life in spite of living with some degree of chronic pain.
Is that why you decided to write the book?
Absolutely. It was this painful ordeal that inspired me to write the book, to promote cannabis as a solution to the opioid crisis. And I did try the opioids and the conventional medication, and they really didn't work nearly as well. To include cannabis as an integral component in the holistic treatment of chronic pain, and to recognize that after nearly 5 decades of practicing medicine, that cannabis is the most powerful, holistic healing herb on the planet.
Today, we meet to discuss something very relevant happening this week: responsible cannabis consumption, especially the safe enjoyment of edibles. I'd also like to hear a bit more about a technique gaining in popularity called microdosing. Gary, why is it important to you to deliver this message, especially before 420?
Well, thank you for the question, Haley. 420 is basically a national holiday for cannabis, and that's a time when it's in the national spotlight. I believe that we are at a turning point in history when using cannabis can become as normal as taking an aspirin or drinking a light beer. But for this to happen, a lot more people will have to try cannabis and have a very good experience when they do, not an extreme one, getting stoned or wasted. This presents us with the challenge of educating people on the smart and proper use of this potent drug. People need to learn to control their dosage just as they do with alcohol. Intelligent people don't get drunk, and there's no need to go there with cannabis either.
Definitely. And Dr. Rav, what's your greatest fear of someone consuming too many servings of edibles or perhaps too much cannabis in general?
Edibles are food infused with cannabis. And due to their inconsistency, I no longer recommend them. I consistently hear from patients that they can eat, and I hear this almost on a daily basis, that patients have had the experience where they'll eat the same size piece of an edible 2 days in a row and have a very different effect. The problem is that the ingredients are not evenly distributed throughout the whole product. So you can't really depend on them to deliver a consistent therapeutic effect, which is why most of the emergency room visits resulting from cannabis overdose are from edibles. My greatest concern with edible overdosing or any cannabis overdose, but it does occur most often with edibles, is that the patients will have had such an uncomfortable experience that they'll refuse to take any cannabis product in the future.
Very true. And Gary, as someone in the edible sphere, what are your basic guidelines for a safe, enjoyable experience?
That's a good question, Haley. The most basic guideline is to start low and go slow. That means a dosage of 5 milligrams or less, and being very patient to give yourself plenty of time for the dose to be fully absorbed before doing more. That should be like 2 hours. Establish a baseline dosage that feels safe and comfortable for you. For example, if 10 milligrams feels good, do this same dosage several times on different occasions before graduating to 15 or 20. Also, learn about the 2 methods of ingestion: chew and swallow, or absorb in the mouth through the cheeks and gum. This latter method allows medicine to absorb directly into the bloodstream for faster and more consistent experience. This is the smartest method of doing cannabis, in my opinion, and definitely gives people the greatest control, value, and bang for your buck. Build familiarity with a particular cannabis form and uptake method, and your confidence and competence will grow from there.
Well, I know your edible Medamints, it's marketed as ideal for microdosing. Can you tell us what this is and how it's relevant to 420?
Microdosing is using the smallest amount of cannabis necessary to give you the basic benefits. So whether that's relief of medical conditions or just feeling good, without necessarily getting high. So sometimes people do this simply to take the edge off, to relax, or to be stimulated. You don't have to be stoned. You can be fully functional and competent. On 420, certainly there's a party atmosphere, but I also imagine a lot of people will be given the chance to experience cannabis for the first time. And I'm afraid that the cannabis community is often very quick to glorify excessive consumption. So that's where we see the clouds of smoke over in the room and over the fields. Likely, and this is like really big bongs and dabs, and it reminds me of college campus binge drinking, and it's not a model we want to replicate in cannabis, and certainly not for everyone, certainly not for new users. So microdosing is especially great for new users and a good way to begin. I advise taking a small dose, waiting at least 2 hours to feel the effects, and then assessing and deciding whether it's the right dose and the person wants to do more.
I'm a huge fan of microdosing myself. I know you are too, Dr. Rav. In fact, it's something you specifically recommend in cannabis for chronic pain. What would you say that makes it such a favorable technique?
Every person is unique and responds a bit differently to any medicine. When prescribing medicine, I've learned that a one-size-fits-all approach just doesn't work. This is why it's important to start low and microdose and increase very gradually. But you need a product that you can depend on to deliver a consistent therapeutic effect, and you know exactly how many milligrams you're getting with each piece of the product. So the only edible I'm aware of with which you can conveniently and reliably microdose are the Medamints. These are cannabis-infused mints that can be consumed as both a sublingual tablet or as an edible. I recommend them both for their consistency and convenience. Their effect can last anywhere from 4 to 8 hours, depending upon whether they're dissolved in your mouth or chewed and swallowed, and then it's an edible. They're sweetened with xylitol, so they do taste good, and a combination of CO2 extracted cannabis oil along with medicinal herbs, spices, and terpenes to either relieve pain, energize, relax, or sleep. There are all 4 kinds of Medamints.
Sounds delicious. Before we conclude, I want to ask each of you for a few parting words of advice for safe cannabis consumption. What would you tell someone who has never had cannabis before?
Cannabis is an extremely safe medicine. I mean, we are living in an age where we've got a public health crisis where opioids are killing 150 people a day. According to the National Center for Health Statistics, there are no deaths directly attributable to cannabis, and very few potential adverse side effects, all of which are THC related. In people who are prone to anxiety, and this includes the vast majority of chronic pain patients, the high THC products can increase anxiety and feelings of paranoia. That's why it's best to begin with a relatively low dose of THC, such as 2 to 3 milligrams. With chronic pain patients, there's a cycle that almost always exists. The pain increases anxiety, which in turn causes insomnia. And with sleep deprivation, there's increased anxiety the next day, which then increases the pain. Cannabis breaks this cycle in 3 separate ways. It directly reduces physical pain, it reduces anxiety, and helps with sleep. It may take several days or weeks of experimentation to determine the ideal product and dosage for you. My book, Cannabis for Chronic Pain, can help shorten this process of trial and error. I have chapters on 20 of the most common chronic pain conditions, both physical and emotional pain, with the medical marijuana recommendations for quick relief, along with the holistic treatment program for long-term pain relief and a potential cure of the condition causing the pain. I can assure you that once you've determined the best product and dose for you, cannabis is highly effective for treating nearly any chronic pain condition, whether it's physical or emotional pain.
Great advice. Gary, what would you tell a first-timer?
Thank you, Haley, for the question. Let me show people this product. This is the Medamint product. We are so proud of this. My wife and friends, we've worked for many years developing this. And it's so wonderful that we live in an era where legalization is taking place, and now there are products of this nature that can be used with confidence in the quality and accountability of the product. So as a first user, you no longer have to worry about getting your product or medicine from the black market and it being contaminated or the cops coming to the door and having to be paranoid like that. So we all should be appreciative of the blessing of living in this era of legalization. And there's nothing that I want more for all you first users than to have a great first experience, second experience, and third experience. So you set a foundation where you're can use this medicine with competence and confidence and not worry about overdosing. You can get past that very quickly. And you regular users, let's set a good example. Let's be conscious that we don't want to sustain and reinforce the reefer madness stereotypes of the irresponsible user. Cannabis is a wonderful plant, and we need to take advantage and love this plant and make sure that the freedom that we are experiencing now with legalization is sustained and expanded so that everybody in the country and the world gets the chance to try this wonderful natural medicine. Learn more about Medamints and cannabis at medamints.com. Follow us on social media. Ask for it. It should be available in a dispensary near you soon. I certainly hope so. Thank you.
And make sure to check out Dr. Rav's book, Cannabis for Chronic Pain. You can find it on Amazon and your local bookstore. Gentlemen, thank you so much for sitting down with me tonight.
It's been a pleasure. Thank you very much.